Canada is a healthy nation, but not everyone enjoys all the benefits of good health. These health differences are mostly explained by conditions in which we are born, live, play, and work. Also known as the social determinants of health, they include things like our income, housing, education, or job opportunities. Discrimination can make being healthy even more challenging. When some groups face barriers within these determinants more than other groups, this is unfair, and we refer to these as inequities. Some inequities may begin in the womb and continue throughout childhood and beyond. Canadian children living in communities with lower levels of education, employment, and income have lower chances of reaching their full developmental potential. Inequities continue into adulthood. For example, Canadians with lower levels of education, employment, or income are more likely to have diabetes and poor mental health. Ultimately, people with lower levels of education or income live shorter lives on average. Other social determinants also affect our health and well-being, such as food and housing. Certain Canadians experience food insecurity more than others. That means they are unable to afford the quantity and quality of food they need for good health. First Nations on reserve, First Nations off reserve, Inuit and Métis people experience higher food insecurity than non-Indigenous people. Black and Latin American Canadians experience higher food insecurity than white Canadians. Bisexual people experience higher food insecurity than heterosexual people. There are also inequities in access to adequate, affordable, and suitable housing. Recent immigrants are twice as likely as non-immigrants to live in housing that is unaffordable, too crowded, or in need of major repairs. Inequities experienced by First Nations, Inuit, and Métis populations are anchored in colonial policies and practices that included forced displacement into reserves and remote communities, the banning of Indigenous languages and cultural practices, and creation of the residential school system. Unaddressed intergenerational trauma adds to the ongoing challenges faced by Indigenous peoples. How do we address these inequities? By ensuring the conditions that support our health, such as good housing, income, education, employment, social connectedness, and access to social support, and health programs and services are equitably available to all Canadians. For Indigenous peoples, this would include addressing the calls to action as outlined in the Truth and Reconciliation Report and United Nations Declaration on the Rights of Indigenous Peoples. Doing this requires a better understanding of the current state of health inequalities in Canada. This information is now available in the Key Health Inequalities in Canada report and the Health Inequalities Data Tool, so that together we can create opportunities for all Canadians to enjoy optimum health and well-being.